everyone. Today we are lucky to have well-known senior orthopedic surgeon Dr. PUNIT Kumar Jain, and we are going to discuss A to Z about knee replacement surgery today. Hello Dr. PUNIT Kumar Jain. I would request to please introduce yourself.
Hello, namaste to all. Myself Dr. PUNIT Kumar Jain. I am senior joint replacement orthopedic surgeon at Fortis Hospital, Shalimar Bagh, Delhi. I am in orthopedics since last 20 years. I had my MBBS and MS training at Medical College, Vadodara, Gujarat. Afterwards, I had fellowships in joint replacement and arthroscopy, and now I am very much dedicated to joint replacement and complex traumas. Thank you.
Doctor, what is arthritis of knee joints?
Arthritis of the knee joints means affection of the knee joint in sense of stiffness, pain, difficulty in the movements. Routinely, we classify knee arthritis into three main categories. One, osteoarthritis or the aging arthritis. That is most common at the upper age groups. This is mainly the degenerative arthritis. Second, rheumatoid or the autoimmune arthritis, which is very much common in the rheumatoid disease. It can happen at any age. And the third most common is the post-traumatic or after any fracture close to the knee joint. That is we call as a post-traumatic arthritis.
Doctor, why does patient complain of knee pain in arthritis?
Knee pain in arthritis is mainly due to two main reasons. One, the stiffness of the muscles or the swelling of tissues close surrounding to the joint. Second, when the bones strikes to each other, just like when we talk of osteoarthritis. Look at this model. If you look at the model, you see this is our normal knee, which has a smooth cartilage covering present surrounding to it. As the age progresses, what we find, this surface gets erodes with the time, and as we go up at the higher age, there is more erosion, so the bones without the cartilage, they strike against each other and gives you pain when you do movements.
Doctor, what is the treatment of knee osteoarthritis?
Knee osteoarthritis or aging arthritis, the treatment very much depends on the age of the patient complaints. So it is very much individualized and planned according to the patient. The treatment is mainly divided into two forms. One, the conservative treatment, non-surgical, and the surgical treatment. Conservative treatment means when the patient is in a younger age with little bit of pain, little bit of degenerative changes, we prefer to save their joint and we look for the options like physiotherapy, medications, and changes in the lifestyle. Surgical treatment involves when the patient is at a higher age and the patient is not able to do his routine life activities and needs something different, and the patient has not received any relief from the conventional medical treatment. The surgical treatment includes total knee replacement surgery, or sometimes we do look for the options like high tibial osteotomy or the unicondylar knee replacement surgeries. The knee replacement surgery is a surgery where we change the damaged joint parts with an artificial implants or the artificial parts. Now let's take an example of a dentist. What he does, in your damaged teeth, they do the RCT and change the tip, the crown of the tooth with a ceramic implant, and they fix over it. They cap over it. Now let's look at the human knee joint. Look at this model. What we see is that the knee joint has three bones. First is your femoral bone, the tibial bone, and the one over there is the patellar bone. What we do in the orthopedics, in the joint replacement, is we change the damaged femoral articular surface and put over this a capping of a metallic implant. Same on the upper bone, same on the lower bone, and put an in between plastic spacer, which helps us in the movement of a normal knee and gives us higher mobility.
Doctor, how common is knee replacement surgery?
Knee replacement surgery is a routine surgery these days, and if you look, it has been performed at all the major centers around the world. Yes, the cases and the number of cases is increasing with the time, and the patients are getting more and more aware about this surgery and the benefits of it.
Doctor, when you recommend total knee replacement to patient?
Knee replacement surgeries are recommended only if the patient fits into our own 5-point criteria. First criteria, the patient comes with a complaint of severe pain and stiffness of the joint and is not able to do his routine activities like getting up from the chair or the dining chair, going in or out of the car, or patient is not able to go independently to the toilet. Second criteria, when the patient comes with a complaint of nagging knee pain, putting them to the sleepless nights, not relieved with the medication. Third important criteria, the patient comes to us with severe deformity or the bowing of the legs and not able to do their routine life activities. The fourth criteria, when the patient comes to us with complaint of repeated joint swelling, history of multiple injections in the joint as aspirations with no relief. And the last, when the patient comes with a history that there is no relief with the conservative non-surgical treatments like medications or the physiotherapy. Then we consider any case or suggest any of our patients to go for the surgery like total knee replacement or unilateral knee replacement.
Doctor, what is the ideal age for surgery?
See, there is no absolute age criteria for the knee replacement surgery. This surgery is recommended to the patient on the basis of their clinical presentation, pain and the stiffness. Ideally, these surgeries are routinely performed in the patients between the age group of 50 to 80 years of age. But worldwide, the knee replacement surgery has been performed in cases with juvenile arthritis in the younger patients or in the patients with their old age coming out with osteoarthritis.
Doctor, please explain in short the whole course of TKR surgery.
See, the knee replacement surgery is not a surgery of a single surgeon. It's a surgery which is very much a result or the good result of a team approach. Yes, we have a complete team of doctors which includes pain management and the pre-assessment team by the anesthesia department. We have a good physiotherapy department which helps the patient to go for the pre-operative exercise schedules and the post-operative exercise. Yes, we have a clerical staff who look after all the paperwork of the patient, help in their insurances, help in their all paperwork of the admission process in the hospital, and the best physician team who looks after all the medical conditions attached with the patient. The whole treatment starts from the first day, the day the patient comes to the hospital. So first, when the patient is examined in the clinic and we assess and we advise the surgery to the patient is examined from head to toe. All the medical history is taken up, the things are put into the data. We put a record of all the medical conditions and the general condition of the patient. Patient is sent to our anesthesia team for the pre-anesthetist checkup. They assess the patient and put us all the need of extra investigations we need to get it done. At the time of the same day, the patient is given an instruction manual. The instruction manual include all the instruction what patient is supposed to make preparations at the home before coming to the hospital, or the patient is supposed to start some kind of physiotherapy at home before the surgery, or what medication patient is supposed to stop pre-admission. A date is given to the patient by our coordinator team, and the day of the surgery or day before surgery we admit the patient early morning. We get all the routine investigations advised by our physician, cardiac team, and the patient is assessed clinically also. All his presentations and the clinical state is recorded so that we can have a reference post-operatively and we can discuss more with the patient. Patient is assessed by our anesthetist team, and the day before the surgery, the night, we have a general discussion with the patients. We discuss all the positive things about the surgery. We try to cool our patient, increase their compliance towards that, as we routinely see that patients are very tense when they come to the hospital for the admission, and they have a lot of queries. So we make it sure that we can spend a good time with the patient, answer to their all queries, and so that they should feel comfortable. The same amount of comfort being provided by our anesthesia team. They do visit in the night hours of the day before the surgery and discuss all the aspects about the surgery or the anesthesia. On the day of the surgery, the patient is advised to take some of the medicines and the patient is shifted to the operation theatre. As the surgery is finished, we say hello to the patient relatives, explain how the surgery went on, and the patient is kept for the few hours in the post-operative room, then shifted to the ICU for the first 24 hours, and the patient is there in the hospital for the next 4 to 6 days, and in that period the patient undergoes vigorous proper training of physiotherapy training so that patient can do his independent job, independent routine activities, or can go to the toilet independently. As the patient is discharged on the 6th or the 7th day post-surgery, we give a complete printed manual to the patient so that they can read about it and can do the self-physiotherapy and can follow up us in the next routine.
Doctor, please explain post-surgery stay in the hospital.
The post-surgery stay in the hospital is around 4 to 5 days for the one knee replacement and around 6 to 8 days for the both knee replacement cases. The post-stay means the patient is trained to walk independently. Our physiotherapy team works on the patient to strengthen up their muscles. The physician looks after the general condition of the patient. If they have any morbidity before the surgery, such accordingly medications are given, and the patient is discharged close to 7 to 8 days of the surgery with all the instructions which they need to follow.
Doctor, when will the patient's stitch be removed?
Once we discharge the patient, we expect the patient to visit us again after a week. The purpose is to look at the operative site and how the patient is doing with the physiotherapy. Then the patient is again called for the second follow-up close to 15 days. The purpose of that day was to, the purpose of the 15th day is to examine the wound. If the stitches are healthy and the wound condition is healthy, we do remove the sutures on the 15th day, or sometimes we do advise the patient to come again after 7 days.